Today we're gonna fix the headache and the neck problem. If you have symptoms of headache or stiff neck, then this technique will help you. So what you can do, the normal range of motion for the neck will be the shin should be aligned with the shoulder. So it will be like almost aligned at my place, and on this side. There we go. My English is not that good, but it will be better. I have to practice this. I'm from Norway, so you can see this. Okay, so you see my shin is almost aligned with the shoulder. This is almost normal. So you can see like this and this. And if it's not, your neck is stiff. Hey, we got it. So what you do is a muscle called levator scapula. I say in Norwegian, so bad English there, but many people know the muscle. You can see it. Here you go. You can see it really good there. This muscle here. So if this muscle is contracted, it puts bad circulation for the tissue fluid and the lymph fluid. So we have a lot of lymph nodes in the body, and if this muscle is contracted, it will not stop, but it will reduce the circulation for the lymph nodes to the neck and to your head. So what you can do then is you follow the muscle when you're bending it over like this, and you can feel this muscle, levator scapula, and you bend it back again, and just where the neck meets the trapezius, there you can feel it. You can see it here. There you can see it. And what I do, I put one finger like this, and I will just like that pull it. And one finger is strong, but two finger is stronger. So I just pull it like that. It should be a little bit sore, a little bit painful, but as you can see, I go deep into the tissue like that. A little bit painful, but if it's painful, it's contracted, and if it's contracted, it keeps bad circulation to your head, to your neck, and maybe you have a headache, maybe you have a stiff neck, but so this should help like that. And what you can do is control it, like going over again. Is it better now? Is it better? Is it stiff this way? Stiff this way? If not, you have fixed it. It's a little bit hard technique, and it can give you headache if you pull it too much. So if it's painful, stop. Okay? It should not be too painful. So just soft pulling it like that. You can bend your head over. You can see the levator scapula like there. It's connected down here. So one finger is strong, two finger is much stronger. So you go down there and you just pull it, go down to the tissue like that, and pull it over. This will help headaches, and it will also help circulation to the neck, so stiff necks. My name is Rune Aabø, and I try to fix you with simple techniques. I have my own clinic with over 2,500 customers every year. So I've been doing this for 7 years, over 15,000 people I have treated with these techniques. So they help. Try it. If you like more videos coming, post below what videos you want or what symptoms you have, and I can try to help you. And if you want more videos automatically come to you, subscribe. I will help you. I will try.